Okay, I'm firing up the simulator again. I want to show some advanced hemodynamics similar to how we were looking at on the cardiac monitor, but with the intra-aortic balloon pump. So the intra-aortic balloon pump, if you are familiar with the Macket, sometimes pronounced Mackay, this is somewhat modeled off of that intra-aortic balloon pump. It, it does look quite different, but it's developed to be a bit of a teaching tool for a balloon pump like that, um, and some of the other balloon pumps of that era. So this balloon pump, when I open it up, we have an EKG reading, we have an arterial blood pressure reading, and we have a intra-aortic balloon pump actual augmentation pressures. So much like your regular balloon pump, actually, the one thing that I do love about that balloon pump uh, when I would teach students how to use it is that it, although it has many options on it, it's very much capable once it's hooked up to a patient's arterial pressure line. And once the balloon is hooked up to the machine, it's very much able to calibrate itself and start itself running. So in that same way, you can actually hit start on this balloon pump simulator and you see it's priming the balloon. It's primed the balloon and is now running. I do apologize, this text is kind of falling off the screen a little bit. I think it has to do with my screen resolution. What I've noticed now that the balloon pump has started running is that I have an intra-aortic balloon pump augmentation pressure waveform. And this is modeled after a realistic waveform. We have the inflation right as the dicrotic notch is taking place on the aortic blood pressure or arterial blood pressure, and then the augmentation pressure levels off as the balloon stays inflated throughout the rest of diastole, and then the balloon actually deflates right at the beginning of systole, and it actually deflates extremely rapidly, showing this even negative inflection on the waveform. We have an augmentation pressure reading. We have the pressure of the balloon set for 100% augmentation, and we can actually change this. I'm not sure if the feature is implemented yet, but we can decrease, yes, we can decrease the augmentation pressure. So not all of the features on this simulator have been implemented as far as these buttons go. Alarms are a relatively new feature, so the augmentation alarm does not actually alarm yet, although that will be implemented in the near future. Also, some of these buttons can be adjusted, such as zeroing the pressure of the arterial blood pressure by hitting zero pressure. Obviously, in real life, you would have to close the line to the atmosphere and zero the transducer to the atmosphere. The simulator skips that part. Um, but we can also change to semi-auto mode. We can change frequency, and by clicking on frequency, it selects frequency and then increase or decrease the frequency. Similar to the real life intra-aortic balloon pumps, when you do click into semi-auto mode and start changing settings, it does pause the balloon. Um, I have seen that happen learning the hard way in real life as well. So very true to real life, the simulator does simulate the machine. So now that I've adjusted the frequency and put it to semi-auto mode, I can hit start again, and now we should see an IABP augmentation of every other beat. One thing that you'll note here is that the arterial blood pressure waveform is modeled exactly as an arterial blood pressure waveform on an actual patient would be with an intra-aortic balloon pump placed. If they're getting a 1 to 2 frequency of counterpulsation therapy, then they will have one beat of the arterial pressure with this big hump of the augmentation pressure, and then they'll have a normal one. So as you would know from the last segment of this recording, if I open up other machines like the cardiac monitor and I select an input of an arterial blood pressure, because Infirmary is reading a patient model and we are actually delivering intra-aortic counterpulsation therapy to a digital simulation of a patient model, their arterial waveform on this is accurate as well. So much like you would see in an ICU, you could use Infirmary Integrated with multiple monitors to both at the same time simulate a balloon pump in a simulation bay next to a patient and the cardiac monitor on the wall. And true to real life, we do have these changes in their waveforms propagate from the balloon pump simulator across the cardiac monitor and similarly across the defibrillator if we opened that up as well. If I close out the cardiac monitor and I'm back to the IABP simulator, there are some dummy values on this as well, and I do apologize because of my screen resolution, these labels are being cut off a little bit. I'm going to have to fix that in the next release. But we do see some labels here that, for example, helium is at 75%. There is no setting in the patient editor for the helium amount, but it is just a random amount, anywhere between, I want to say 50 to 100%, so that the student can be aware that there is typically a reading on the balloon pump for how much helium this machine has in it, but doesn't actually have to respond to that clinically. As a previous critical care transport nurse, I feel it's important to have values like this so that nurses being trained, for example, going out on the ambulance or the helicopter, know that it is important to check this helium value before taking the balloon pump off site and the patient into transport. So the simulator does include values like that to prompt that education in the simulation. We can also adjust the trigger by hitting trigger, increase, decrease. And once again, in semi-auto mode, we've switched it to pressure trigger, although I have to increase, there we go. Now the labels are fitting properly. And I can start again, and now it's running off of a pressure trigger. So that is it for the segment on the IABP or intra-aortic balloon pump simulator. I'm going to pause the recording and start a new simulation so we can look at even more features that Infirmary has to offer. Oh, and we can switch this. Before I pause, the color scheme, just so that you know, the reason that color scheme was implemented was so that you can pause this device and take screenshots of these waveforms and be able to print them on paper in black and white to be able to provide for educational purposes as well. So that is an option.